Umbilical cord stem cells have been basically the same kind of stem cell, the hematopoietic precursor cell that's found in normal cord blood. They take the cord blood and they isolate that cell, and they then grow it in tissue culture and put it in vials of 1.5 million cells. There's been over 4,000 cord blood transplantations, and in the United States over 1,000. In regard to purified stem cells, the kind that we're using, there's been about 1,000 of these given over the last 4 years in different offshore clinics. It's interesting that no ABO and HLA typing is done. No chemotherapy or radiation is given prior to the transplantations, and none needed. And in fact, there's been no graft versus host disease have been reported. There's been no deaths, and no short-term or long-term problems have been seen in the 100 cases that we've been following. We followed 8 children, 3 to 12 years old, with cerebral palsy, and out of those children, 75% at 6 months had significant improvement in all of their different problems. Some of the things that we learned about the clinical use of stem cells is that, number one, acute inflammation and tissue destruction where the endothelium and blood-brain barrier is open provides the best clinical results in our experience. Why are we not using umbilical cord stem cells when we have, they're plentiful, they're thrown away right now, they're free, basically you just have to process them a little bit. The methodology is available now for expansion and tissue culture. We can take them up to 10 doublings, so from one cord you can get 30 patients treated without any problems, and it just makes no sense to me that we're going off in this direction when we already have stem cells that have been clinically proven for 16 years. We've got 4,500 cases already done and without any side effects. So I'm making a good strong case for umbilical cord cell use.